Check out the latest highlights from the Nourishing You podcast.
I want to go back and just make sure that our audience heard what you said in terms of the dosage of vitamin K2, because you said 45 milligrams, right? And
Correct.
Usually most supplements dose vitamin K2 in micrograms, which is a huge difference. So this is a very different, distinct recommendation than what is in a typical supplement for vitamin K2. So I just want to make people aware of that.
And when you see those microgram doses, you need to look at the form of vitamin K2. Typically, that's going to be the MK7 form, not the MK4 form. And it needs to be that 45 milligrams per day of the MK4 in divided doses. That's what's been shown to promote bone health and maintain strong bones in the clinical trials.
So they may want to work with a nutrition professional to find that kind of a supplement, because it's not going to be something that you're going to go grab off the shelf somewhere at the store, likely.
They're correct. And in fact, if I may, a little bit of my backstory of how I also I started my dietary supplement when I was in a supplement company. When I was in clinical practice and started looking at and I was using a lot of nutritional medicine with patients, I couldn't find, in terms of helping them with their bone health, as I discovered this research and was getting deeper into the research, I couldn't find any products on the shelves that had the dose and combination of the nutrients shown in clinical trials to work, not only for bone health, but for other indications I was working with them on as well. So I created a company to create the first product that actually in the US that had that clinical dose of MK4 plus calcium and vitamin D in it, all combined in one product. And since then, we've shipped into 15 countries, and we're distributed by distributors to healthcare providers and practitioners, and it's just been amazing to be able to provide that solution.
If you enjoyed this short episode, check out our full library on our NAMP YouTube channel, where you can catch up or learn more. Keep in mind that the information on the NAMP podcast is for educational purposes only and should not be considered medical or legal advice. The NAMP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NAMP and all agents. Copyright NAMP, all rights reserved.